Up next, we're going to start rolling with optometry and ophthalmology, which is a major theme of the conference. Matt Young actually sat down with Dr. Rajpal of Johnson & Johnson, and the topic of that is going to be building a successful optometry-ophthalmology model. Let's check it out.
Raj, welcome to the program.
Thank you, Matt. It's a pleasure to be here.
Well, today, Raj, we're talking about how to build a successful ophthalmology and optometry model. Can you tell me a little bit about what you think about these fields of ophthalmology and optometry coming together?
Sure. I think we're seeing that ophthalmologists and optometrists are understanding better how to partner, how to provide care that ultimately allows patients to access it more easily, but also ultimately to achieve the best outcomes that are possible for them.
Raj, I'd like to show you this picture from your See Clearly Vision Group website. Now, these young professionals look great. Interestingly, on the website, it also says, and I'm reading here, our practice is made up of talented ophthalmologists and optometrists dedicated to providing you with the best visual outcomes possible. Can you tell me a little bit more about how these talented ophthalmologists and optometrists can work together for patient outcomes?
Sure. So I think our practice is a good example of the partnership between ophthalmology and optometry. So I'll give you a couple of examples.
Sure.
In corneal treatment, keratoconus, for example, our optometrists fit a tremendously significant number of scleral contact lenses and other contact lenses as well that help those keratoconus patients with irregular corneas see their best. The ophthalmic surgeons do the surgical procedures related to that same condition, whether it's corneal cross-linking or corneal transplants or whatever other needs the patient may have. Similarly, in refractive surgery, we are able to work together with our optometrists because the patients are generally coming in for their annual eye exams with the optometrist and they know what their needs are. And then when the patient is ready for surgery, the ophthalmologist and optometrist can collaborate better in terms of what's the best lens implant that can be selected. Do they need femtosecond laser technology to correct astigmatism for the cornea? If they're having LASIK or PRK, should they have monovision? What does the patient need? What are they used to in their contact lenses? So these are all things that optometrists and ophthalmologists can collaborate more easily on because often one will know the patient better than the other. And ultimately that guides what the patient treatment is going to be.
If we come back to the myopia epidemic in the younger population, how can optometrists and ophthalmologists really work together? And what would you say Johnson & Johnson is doing especially to encourage this?
Myopia is a true epidemic. It's estimated that half the world's population will be myopic by 2050. It's important for all of us to understand that increasing rate of myopia causes other eye diseases as well. And again, this is something where there are multiple products that now are available and others that are under development that both optometrists and ophthalmologists working together can help young patients. We have the AccuView Ability lenses now available in certain markets across the world. This allows optometrists primarily, but ophthalmologists also use it in certain markets to perform Ortho-K, which allows the shape of the eye to change and hopefully prevent myopia from progressing. Other advances that are coming, whether they're pharmaceutical or otherwise another technology, where hopefully we will be able to, again, work together and have less of this myopia epidemic be as significant as it can be.
Just as a follow-up to that too, where do you think orthokeratology lies in the spectrum between ophthalmologists and optometrists? Because it technically would be a contact lens, but it's also a device that sort of molds the cornea. So I wonder if there's crossover in that area as well.
So first, it always comes down to that geography as to what's allowed. Whether it's optometry, ophthalmology, being able to prescribe those. I would say in most markets, it's optometrists who are best at doing this. They know how to fit contact lenses in general better than ophthalmologists. There are some pediatric ophthalmologists who are great at that. Certainly some cornea practices as well. And I think as long as it's care that is provided with clinicians who are well educated, it can certainly be done by either. And then as long as, again, they all know how to manage any issues that are arising that need urgent follow-up. What we're seeing within the business is certainly is primarily optometrists who are interested in this, those that are most interested in myopia, but it does cross over.
Let's talk about wait times for a moment. While wait times vary between the states and territories in Australia, for example, a significant number of ophthalmology patients wait beyond the clinically recommended times of 30 days for urgent cases. It isn't even unusual for less urgent patients to wait more than 300 days for their initial ophthalmology outpatient appointments in the public health system there in Australia. So my question is, could a co-management model between ODs and MDs help to reduce patient wait times?
Yeah, I don't know the specifics in Australia directly, but you've summarized them certainly very nicely. And there are other parts of the world as well where these wait times are significant and impacting quality of life for patients. And I think co-management may be one way. As we know, the demographics are changing and the population is aging, and there's greater need, for example, for surgical procedures like cataract surgery. If we can have ophthalmologists focused more on that, an optometrist providing more of the primary care, and then collaborating, as you said, in a way that allows both specialties to then see more patients. Absolutely agree with you. And there are multiple other things that need to be done, whether it's reimbursement models need to change, or the delivery models of how surgery is performed. But absolutely, these are multiple steps that I think all have to come in together, and and then it becomes by geography how you improve that, I think, overall.
Now let's go back to Washington, D.C. for a moment. Coming from someone who has actually done it, how do you build the most effective and efficient co-management model? And are there products at Johnson & Johnson Vision that are supportive of such models?
First and foremost is always, of course, keeping the patient at the center of this. What's most appropriate for each individual patient, what's most convenient for the patient, and making sure that they're having access to whether the ophthalmologist or optometrist at all times. Second is making sure that medical information and the care that's provided is easily transmissible. So that's one of the areas that J&J is certainly focused. Our opportunity to get digital health, whether it's through electronic health records, eventually maybe through artificial intelligence and machine learning, but be able to have that easily available to all parties involved in the care. And then finally, again, that partnership continues to evolve with better and better communication, hopefully. Going back from the J&J perspective, we're trying to provide those technologies that allow a connection between surgery center, primary care provider, surgeon, all of those aspects, whether it's measuring for lens implants or whether it's measuring with a wavefront device to determine what's the right refractive surgery correction to do. So, being able to connect all of those devices as well as then understand from those technologies how we get the best outcomes. That's the direction that we're going as an organization.
Well, Johnson & Johnson Vision has both surgical vision and vision care divisions, but in some cases they may be siloed to address surgeons and optometrists separately. Could there be ways to integrate the business units to help better reflect the coming together of optometrists and ophthalmologists to meet issues head-on, like the growing myopia epidemic and dry eye?
I think what you just mentioned is perhaps the most significant example of the collaboration between the vision care and surgical vision business, which is dry eye treatment. Tear Science, LipiFlow, and LipiView are perfect examples where both optometrists and ophthalmologists do utilize that technology. Myopia is another great example. So we are seeing places from a business efficiency perspective that is better, but then also where the collaboration between optometry and ophthalmology happens clinically, that we can provide those services better. At the same time, there are some things that just are very different between optometry and ophthalmology. And again, if an ophthalmologist doesn't fit contact lenses, then they're really not going to have any interest in learning too much about AccuView contact lenses, for example. Of course, they need to know about it, but just the basics. So there will be areas that are always going to be somewhat separate, but there are plenty of areas where we're continuing to merge those and improve how we function as an organization for that reason that you described. Ultimately, again, getting to better care for patients and clinicians knowing how to deliver that best.
And I think in a market like where we're broadcasting from, Vietnam, where ophthalmology has been the traditional segment, and really it's only been optometry that has started to grow up in the last 3 years, it still might be ophthalmologists that are providing even orthokeratology, but that maybe this new segment that's growing up could be areas where there's more collaboration. Would you agree?
Absolutely agree. We don't have enough providers in many markets be able to provide care, patients to get access quickly enough. We have to come up with better models for that healthcare delivery. And it's not just in eye care, it's happening throughout other aspects of healthcare as well.
Well, Raj, we've had such a thorough discussion here on today's talk show. We've gone from Washington, D.C. to Australia to home here for us in Vietnam. So thank you so much for joining us here on MICE TV. It's a great pleasure to have you, sir.
Matt, thank you so much for the invitation. Great discussion, great topics, and look forward to continuing to help in the future.
you.